Thank you for that. Minor technical issue there. All right, well, it's on the hour, so I'll get started. So welcome everybody to our FACE seminar series. Today is the emergency medicine rotation, and speaking to us today is Colleen Saunders. And Colleen and I know each other from very long ago, and Colleen is an expert in all things water sports related, particularly serious events that happen in the water, particularly drownings, which she did her PhD on. And so Colleen is talking to us today about who holds the lifeline.
So it's not the link, it's in the attach.
Somebody needs to mute, please. Shifting drowning prevention beyond the water's edge. Before Colleen gets started and before I hand over to her, if any of you would like CPD points for this seminar, I'm going to drop my email address in the chat bar. Please just email me your HPCSA registration number and I'll arrange the rest. And we will arrange for that CPD accreditation, which, as we all know, is now more important than ever. So on that note, thank you, Colleen, for chatting to us, and I'm going to hand over to you.
All right, thank you very much for the introduction, Jaron, and thank you everyone for joining over lunchtime after a long weekend. I think everyone's still very much in holiday mode. So this presentation is really around drowning prevention in South Africa and poses the question on who holds the lifeline. I'll give you a spoiler alert that I don't have the answer, but hopefully it can generate some discussion around where the responsibility for drowning prevention sits in South Africa. So I'm an associate professor in emergency medicine at UCT, and I also, in a voluntary capacity, am the deputy director for drowning prevention at Life Saving South Africa, which is a non-profit responsible for life-saving services, voluntary life-saving services in the country. Drowning, I think, is something that many people are familiar with. They will know the term, but there are some technicalities around the definition of drowning, which are relatively recent sort of advancements. And so I'd like to just start this presentation elaborating a little bit around what drowning is and what it isn't, and why that's important. So in about 2005, there was a consensus definition of drowning developed, which you'll see on your screen. So drowning is a process of experiencing respiratory impairment from submersion or immersion in a liquid. And what's really important here is that drowning is a process. So it's not a once-off event necessarily, but it is a process that can be interrupted at any point from when someone experiences immersion in a liquid. And the outcomes from a drowning event can be fatal or non-fatal, and non-fatal can be associated with morbidity or no morbidity. And this largely depends on when and if the process of drowning is interrupted. The submersion time and the degree of oxygen sort of deprivation is really what determines the level of outcome after a drowning incident. Many of you will be familiar with the drowning chain of survival, the cardiac arrest chain of survival. And similarly, one has been developed for drowning, which is really a structured approach to thinking about how that process of drowning can be interrupted at various stages. So similar to cardiac arrest, there are many opportunities for preventing the need for treatment or management. And it's only one ring in the chain of survival, but really I think prevention is probably one of the biggest and most important aspects of the drowning chain of survival. And then there are multiple opportunities in a drowning process to recognize distress, provide flotation, and remove someone from the water safely. All of these aim to essentially remove someone or get someone above the water and reduce the amount of submersion time and the potential for oxygen deprivation. Some of you may be familiar with a mnemonic that's really important in the drowning chain of survival, which is reach, row, throw, or don't go. And we often think of rescue as the way that we interrupt the drowning event. But sometimes, if you are untrained, trying to do so and interrupt this process can actually lead to another drowning incident. And so often rescuers themselves are become drowning victims. And so the mnemonic reach, row, throw, don't go unless trained is really important when we start to talk about removing from water, providing flotation, and making sure that rescuers are safe. And then the final step is really around providing care once someone has been removed from the water by whether it's rescuers, EMS, or lay public, but making sure that the treatment that they receive can reduce or minimize the harm that's caused by a drowning incident. So the reason why I start with the definition of drowning is because it is really important. We have for a long time spoken about things. I mean, I distinctly remember using the term near drowning. It's something that's used a lot even still. I've seen it in medical notes, current medical notes. It's used in the media a lot. But we have moved away from terms like near drowning, dry drowning, secondary drowning, to really focus on using the appropriate definitions and the use of terms like fatal drowning or non-fatal drowning. And this is really important because a non-fatal drowning is still a drowning event. And so using a consistent language that identifies a drowning incident as a drowning incident, regardless of whether it was fatal or non-fatal, emphasizes that it's still an emergent issue. It requires immediate attention, and it standardizes the way in which we assess and treat a patient rather than distinguishing or categorizing a near incident from an actual incident. It helps us when we move away from terms like near drowning, which is a little bit vague, and we don't really understand what it means. Does it mean someone nearly fell in the pool? Did they fall in the pool? Did they have respiratory impairment? What does it actually mean? Moving to a more consistent language helps us to understand exactly what we're dealing with. It also, things like near drowning tend to imply that there were no lasting consequences to an incident, when we know that in actual fact, non-fatal drownings can have very serious health impacts which last a lifetime. And these can include neurological or respiratory issues. And as an example, if we think to the field of road traffic crashes, we don't often talk about a near road traffic crash. We'll talk about road traffic crashes where there was an injury or no injury, or there was a fatality or no fatality. But we understand that a road traffic crash always has the potential for a very serious injury or death. And so using fatal and non-fatal drowning as terminology and moving away from a near drowning, which is very, very vague, can help us to understand that these things always have the potential for serious health impacts. And probably the most important reason why the definition is important is that it supports surveillance efforts. So if we are not counting non-fatal drowning incidents, we really underestimate the burden of drowning, bearing in mind that every non-fatal incident could have been fatal, and it could also have very long-lasting health impacts for both the individual, their family, and the health system. So using standard terminology that is universally, internationally accepted, allows us to compare across regions, geographical regions. It allows us to look at trends, and it really allows us to capture all relevant cases, which is important when trying to establish what the burden of drowning is. And so increasingly, globally, drowning is recognized as quite a significant public health issue. In 2021, the United Nations General Assembly passed a resolution on global drowning prevention, within which they recognized that drowning has been the cause of over 2.5 million preventable deaths in the past decade. I think the recent report that has come out has pushed that up to over 3 million in the last decade, but at that time it was the estimates were 2.5 million. The resolution that was passed by the UN General Assembly in 2021 called for a number of actions from member states on drowning prevention, or drowning, on the issue of drowning. The first of which was to appoint national focal points in each member state, to develop national drowning prevention plans containing measurable targets, integrating drowning prevention within different disaster risk reduction programs, and very importantly, to incorporate water safety, swimming, and first aid lessons in school curricula. They also called on the WHO, the World Health Organization, to support member states in trying to achieve these goals and to take over the coordination of drowning prevention globally. So shortly thereafter, 2 years later, the World Health Assembly passed a resolution on accelerating action on global drowning prevention. Within this, there were similar calls. These echoed the United Nations resolution to appoint national focal points, assess national drowning situations, develop and implement multisectoral programs, look at integrating policy planning across different sectors, and to promote drowning prevention awareness within countries. They also called on the Director General of the WHO to issue a global status report on drowning prevention by the end of 2024, which they were able to do just in the nick of time. I think they managed to publish it in December 2024. So the WHO first global status report on drowning prevention estimated that there were more than 300,000 drowning deaths globally in 2021. And it's very important to remember that, or to understand that these estimates exclude fatalities from flood-related drowning and transport-related drowning. So we know that they are likely an underestimate of the true burden. About a quarter of drowning fatalities annually are in children under the age of 5 years old. And if you then look at children under the age of 15 years old, it goes up to about 43%. So we know that our children are the ones that are bearing the consequences of this global drowning burden. Africa carries a very heavy drowning burden. It is the region, the WHO African region, has the highest drowning mortality rate at 5.6 per 100,000 population. But it also, across the region, there are around 66,000 drowning fatalities every year. About 90% of global drowning occurs in low and middle income countries. And we estimate that this will increase in coming years because of climate change. So the risk of drowning is likely, the risk and profile of drowning is likely to change because of increased hydrometeorological disasters, so things like floods and cyclones, as climate change causes disruptions to fishing stocks and populations, droughts, etc. We think that there's going to be an increase in riskier behavior around water. Heat waves as well are likely to increase people's exposure to water as they seek different ways to keep cool and manage their lifestyles. So we estimate that there is going to be an increase and a change in drowning risk, and this is largely going to be felt in low middle income countries. One of the most important things that the global status report showed was that in the last 20 years, there's been a global decline in drowning rates. So at a overall global level, the drowning mortality rates have decreased by about 38%. And we can see this across most regions, most of the WHO regions, with the exception of Africa. So Africa is largely, as a region, being left behind in terms of drowning prevention. Over the same period, where the global average was a decrease of 38%, the drowning mortality rates decreased in Africa by only 3%, which is really small and probably indicates that things are, it's probably a little bit of variation more than it is an actual decrease. And so globally, we're seeing an increased focus on drowning in the African region and support from various organizations and particularly the WHO to look at how we can increase or improve drowning prevention and capacitate it within Africa. The global status report also has, as it has with many other injury conditions, it has a country profile for each of the participating countries. And the current estimates of the burden of drowning in South Africa vary between about 1,500 a year, that's from the Statistics South Africa data, and to about 2,700 a year based on the WHO Global Health Estimate modeling, which accounts for some of the sort of redistribution of codes that are uninformative. And so the estimate is really somewhere around between 1,500 and 2,700. What you can see from looking at the rates of drowning over time is that they really, as much as there's been a decrease globally, we're not seeing that in South Africa. So if anything, there's almost a slight increase in the drowning rates over the last 20 years, which is the period of the status report. We know that this is pretty consistent. The ratio of male to female drowning in South Africa is about 4 to 1. So it is about 80% of drowning occurs in males. This is a much smaller ratio in young children. So it's closer to 1 to 1 in children under 5. But the ratio of male to female goes up to between 12 and 14 to 1, depending on different age groups within adults. And so our kind of young adult males are very much an at-risk group in South Africa. We still see the highest rates, the age-specific rates in children under 5 years old. But when you look at age and sex-specific rates, we see very high rates in these young adult men between 20 and 35. The highest numbers, and this is from South African police data on the right, if you look at the map, the highest sort of proportions of drowning occur largely in the coastal provinces of South Africa. But when you look at rates per population, there's quite a high drowning rate in, for example, the Northern Cape as well. So we have this tendency to think of drowning as a coastal issue. We sort of think of it happening in pools and we think of it happening in at the sea. But really, drowning is a problem that affects almost all of South Africa, and can actually be quite high in, or the rates can be quite high in non-coastal provinces as well. There's not a lot of data around where people drown and the specifics in terms of bodies of water, and also what they were doing at the time that they drowned. But we have pretty good data from the Western Cape. And in Western Cape, given that it is a coastal province, about just under a third of drowning occurs in the ocean, about a quarter in dams, so ponds, dams, and lakes, and about a quarter in rivers and canals. Both in the Western Cape and in South Africa as a whole, when we look at the South African Police Services data, about 13% of fatal drowning occurs in swimming pools. But we aren't, we don't have a very good indication of the different bodies of water when you look at it nationally or in the inland provinces. South Africa, I think it's fairly obvious, but about 60 to 70% of our fatal drowning incidents occur in spring and summer. Obviously, very high aggregations of these incidents occur kind of December, January, our peak summer period. What's interesting is that about just under half of all our incidents occur on weekends and public holidays. And there is a higher risk of fatal drowning on long weekends and public holidays than there are on normal weekends. We don't know for sure, but some of this, I think, is likely to do with the way that we tend to celebrate public holidays in South Africa. We have a culture where there's a lot of alcohol, there's a lot of celebrating around water bodies. We do enjoy, being out around water of different kinds, and often that goes hand in hand with celebrations that involve alcohol. So between the alcohol and the increased exposure, we definitely see an aggregation of drowning incidents around public holidays, and particularly on long weekends that are 3 days or more. They tend to happen in the afternoon and early evening, so we definitely see higher proportions of incidents in the afternoon and early evening, and particularly in our very young children, so those under 5 years old, we see higher proportions of drowning in that sort of late afternoon, early evening, which is often when people are busy, returning from work, perhaps, and maybe getting dinner ready. You are distracted by other household chores, maybe older children, and so we see a very peak risk period for these young children in that time period where I guess households are in general a little bit distracted and supervision lapses are easier to happen. In South Africa, we do not have very good data in terms of our surveillance around what people are doing at the time of a drowning incident. And so a few years ago, we took the Life Saving South Africa media database. So they have a database in which they are actively collecting media reports on drowning. So just to be aware that these are based on media reports and not any kind of formal surveillance. But we tried to have a look at those and categorize based on the media reports what the descriptions of the activity prior to incident were. We were able to take a data set of about 1,400, I think it was closer to 1,400 drowning incidents, and interrogate those or categorize them for what people were doing, what was the actual activity at the time that they, or reported activity anyway, at the time of the drowning incident. So intentional swimming, if you look at, this is in under 19 years, so the WHO categorizes children up until 19 years, and if we look at that group, they were intentionally swimming in about 62% of reported incidents. And in the rest, so in the other 38%, about a third of those were playing near water. So they weren't actively intending to get into water, but they were playing near water. And what was concerning is that in a number of those cases, those were on construction sites. So we saw a number of stories around children playing on construction sites that were, not busy over the weekend or etc. Pits had been dug, there was water had accumulated because of rain or something, and they were actually using that to cool down and play in the absence of other safer places to go and swim. About 14% of those are in children crossing rivers, and so this is particularly prevalent in KwaZulu-Natal and the Eastern Cape, and it's often on school journeys as well. In the same exercise, looking at adults, so over 19 years, again, intentional swimming was reported in about 42% of cases, and just over a third, so about 37% of those where they were not intentionally swimming involved some kind of watercraft, either motorized or non-motorized. And one particular issue, I think that's very prevalent in South Africa that we hear about a lot, that is not something that we've seen elsewhere in data reported globally, is the issue of drowning during cultural and religious ceremonies. And I think this is something that as South Africans, we really need to understand what those, how we can respect those ceremonies and those cultural traditions, but making them safer so that we reduce the drowning risk during those. So I think what's really important to acknowledge is that drowning is a very multisectoral issue. Often when you have conversations around drowning and drowning prevention, people will default to drowning prevention being going into schools, teaching our school-age children water safety, or in some cases learning how to swim. We've just recently done a survey of beachgoers across South Africa, and 36% of people that were at the beach at the time that we did the survey said that they couldn't swim. And if you took it up to those that could swim less than 25 meters in a swimming pool, it's about 60%. So I think we have a culture in South Africa where many people are not able to swim in a way that they would be able to to be confident out in a pool or in the sea, or a river or a dam. And so a lot of our current prevention activities tend to focus on going into schools and teaching them around water safety, and perhaps in some cases, a few cases, around actually teaching swimming skills as well. But I think the challenge with this is that often those events happen on an ad hoc basis. They are driven by several organizations, several civil society organizations in South Africa who are working hard to try and improve the coverage of that in our schools. But they're often on an ad hoc basis with a few lessons and perhaps scattered over a couple of years within the schooling career. They're certainly not on a consistent level, and it's difficult to learn how to swim properly in a few lessons scattered across your schooling career. And so I'd like to challenge that. I think these are important, and I don't want to take away from these programs. I think they're really critical, and there's a lot of people doing really good work here. But I'd also like to challenge that if we can go into schools and teach kids how to swim, how to be safe, give them some water safety skills, but they have to get to school safely in order for us to do that. And in many parts of South Africa, there are children crossing rivers on a daily basis to try and get to school. This is a river in KwaZulu-Natal where children are holding their school clothes above their heads. They have to cross this river twice a day to get to and from school. We can't teach them water safety in our schools if they can't get to schools safely. We also can't, if they aren't safe in and around their own homes, we can't get them to school. We can't teach them water safety. We can't teach them how to swim. Many of the risks that people experience, drowning risks that people experience on a day-to-day basis, are in and around their homes. They're in the infrastructural challenges that they experience on a daily basis. I think flooding is an increasing issue in South Africa. We've seen it repeatedly in KwaZulu-Natal. If we can't solve this issue by teaching children what to do if they get into trouble in a swimming pool or at the sea. There are infrastructural, social, geographical inequities in South Africa that make drowning risk something that is broader than just teaching people how to swim. We have to address some of these big multisectoral issues and try to acknowledge them in order to address them. So when I talk about drowning prevention, as I say, a lot of people sort of default to the education and awareness programs and what have you. But drowning prevention from a global community perspective is a much broader multidisciplinary concept. So there's been some work done around trying to define what drowning prevention is, because there was so much variation in how people understood it. But really, it is a multidisciplinary approach across many different sectors that aims to reduce drowning risk through addressing some of the hazards, exposures, and vulnerabilities that people experience as both individuals, communities, and populations, and trying to minimize those risks to protect against fatal and non-fatal drowning. Drowning prevention has been shown to be cost effective. So the WHO has done some work on two interventions that are highly recommended for preventing drowning. And that is providing daycare for children, so safe places away from water, and including water safety and swimming skills training for children 6 years and older. So based on purely those two interventions in about 50 high burden countries, the predicted return on investment for every dollar spent globally in these high burden countries on those two interventions would save about $9 in terms of the costs and the health impacts because of either fatal or non-fatal drowning. So drowning prevention is a very cost-effective public health strategy. The recently published, so the Global Status Report on Drowning Prevention, has reported on the status of drowning prevention in South Africa. You're able to have a look at the country profile at the back. We have a number of awareness programs, but many of these are at a sub-national level. So that means they are very localized, either at provincial or maybe within different municipal areas, and they have limited coverage. We don't have a coordinated awareness programs at a national level that speak to consistent messaging. Many of the organizations have their own awareness campaigns. There's not a lot of consistency across the programs that are, well, the awareness programs anyway, that are implemented at the moment. We do very well in terms of our rescue and life-saving service provision. So you'll see that as indicated by the report, we have lifeguards, we have rescue and rescue programs, largely implemented sub-national level, but they have very high coverage or extensive coverage. So our lifeguarding and our rescue organizations in the country are well recognized, and they provide a very high level of service. But there are a number of other interventions on which we are not doing very well as a country. And so the first of those is including swimming and water safety consistently in the school curriculum. And so it is there to some extent, and there's certain patches of it within the school curriculum, I think particularly in the life orientation curriculum, but it is very much not consistently applied across the country and in all schools. We are not very good at legislation and interventions aimed at installing barriers that limit access to water. And although we have a strong disaster risk reduction sector in South Africa, there is not a lot of incorporation of drowning prevention into much of our disaster resilience and our disaster risk reduction programs. Our policy and legislation environment when it comes to drowning prevention is quite weak. And so everyone I speak to about this says, but we do have legislation around pool safety and barriers. But the reality is we don't. We have building regulations that say if you have a swimming pool, a private swimming pool, you must have a wall around your property. We don't have any legislation in South Africa that speaks to fencing around private or recreational swimming pools. And by around the swimming pools, I mean within a very close proximity to the swimming pool, not just the border of the property. And so I think this is probably one of the biggest opportunities that we have to start to try to meet some of the global recommendations around drowning prevention. And we've done, I think I saw some of my disaster management colleagues joining from the Western Cape, but they have initiated a process certainly in the Western Cape where we have drafted standard bylaws relating to private swimming pools. These have gone through about 2 years of work to get to the point where we have a draft standard bylaw, and we're now looking at how this could be implemented or put into place. But I think this is probably one of the biggest opportunities for drowning prevention in South Africa, is to really look at how we could protect children on our properties. So we have regulations to protect children that do not live on our properties from our swimming pools, but how do we protect our own children living in our own homes from accidents and falling into swimming pools and drowning? This is, I think, easily one of the most achievable targets for us locally. I think one of the second opportunities, the biggest opportunities for drowning prevention in South Africa, is around the governance and coordination. So both the UN resolution and the World Health Assembly resolution call for improvements or establishing governance and coordination mechanisms for drowning prevention in different member states. They call specifically for appointing national focal points for drowning prevention and the development of strategies with measurable targets, and the establishment of coordination mechanisms. And at the moment, we don't have any of those. So we have pockets of excellence. There are a number of organizations doing excellent work around drowning prevention in South Africa, but we don't have a coordinated mechanism from within government or even outside of government to make sure that all of those efforts are coordinated and that we can really maximize the impact of the work that people are doing. So the question that I posed at the beginning of this presentation, or in the title, is who holds the lifeline? So who is responsible for drowning prevention in South Africa? And who should hold accountability for drowning? I did see Valencia is on the call as well. One of my MSc students has undertaken a project to try and explore some of this. So specifically speaking to stakeholders and trying to understand the current perceptions around who is responsible for drowning prevention or drowning in South Africa. We sat down and we came up with a whole list of different departments and organizations and stakeholders that we wanted to invite to this project. We sent out, I'd say, at least 30 invites, and we only got 7 interviews confirmed as part of her project. So 3 of those were from civil society organizations, and only 4 came from government. And I think to our disaster management colleagues on the call, most of those were from the disaster management sector. So it is a very small number of interviews, but we did have quite a high level of experience within those 7 interviews. And in exploring this issue of who should be responsible, where does the responsibility sit for drowning prevention, and how do we get this onto the public agenda in South Africa, there were 6 categories or 6 themes really that came through. And the first is that drowning is recognized as important. So there is awareness that drowning is an issue, and that it is under-recognized as an issue, but it's not prioritized because it is lost in the big, broader injury and trauma burden in South Africa. The second theme that came through very strongly was that collaboration and strong partnerships are crucial. And this was between civil society organizations, but also between civil society and government. There was a strong feeling that civil society has, and a lot of our NGOs have strength in that they're a lot more agile, they are able to capacitate government strategy, but they're also hamstrung because they don't have a lot of power. And we need political champions and political leadership to help support those actions. And so collaboration, particularly between government and civil society, could really increase impact of drowning prevention. What we saw repeatedly was that national policy is very critical to prioritizing drowning prevention. So many of our subnational level participants sort of pointed out that the priorities at either the local or the regional level are often driven by national policy and national agendas. And so I think it speaks very much to this issue of having some kind of coordinating or national level guidance around drowning prevention. And I'm not going to go through all of them, but the last theme that I want to just pick up is that because drowning is so multisectoral in nature, this makes it quite tricky to almost allocate to someone to sort out, right? Whose problem is it? Because it's actually everybody's problem. It's cross-cutting across so many different departments. And this makes it really difficult to appoint or to allocate accountability for drowning. So if we look specifically at that theme that emerged, we know that the risk factors for drowning in South Africa are very wide-ranging, and they are multisectoral. They cut across, I think there's something like 30-odd different government departments, and they cut across easily half of them. We know that the Department of Health specifically bears the impact of the drowning burden, either through fatalities or through the morbidity that's associated with non-fatal drowning. And there's a very clear recognition that the education sector is critical. So as a partner in terms of prevention, the education sector really plays a very pivotal role. But what was clear is that there's absolutely no consensus on who should be a lead agency to almost be appointed as the national focal person around, or focal point around, drowning prevention. Everybody had a different idea on where that accountability should sit. But almost everybody agreed that at the moment, there isn't a strong degree of accountability for addressing the issue of drowning in South Africa. There were a number of suggestions around this sitting, around sort of cross-cutting work groups, or different names for work units, really, that are cross-cutting across either the Department of the Premier at for example, a provincial level, or the Office of the Presidency at a national level. But that given the multisectoral nature of drowning risk, that maybe it shouldn't sit within one particular department, but should be something that sits in a very interdisciplinary, multisectoral unit. And so I'll finish off shortly with just some, I think, key takeaways. I think that our biggest opportunities, based on the Global Status Report on drowning prevention, I think our biggest opportunities for impact in South Africa are really, firstly, to improve our governance and coordination from a national level. And I think this needs to be, we have a lot of very strong and very vocal civil society and NGOs, organizations in South Africa, but I think there needs to be a stronger voice within government as well for having some strong leadership and coordination around drowning prevention, so that it comes from the top down. We already have a lot of voices from the ground up, but we need some top-down leadership and coordination across multiple sectors. So this isn't necessarily something that should only come from Department of Health, who bears the impact, but very much across sectors in South Africa. I think in implementing or establishing those coordination mechanisms, I think we need to harness the civil society, the strengths of civil society organizations at the moment, and strengthen those partnerships with government, so that a lot of the really good technical knowledge, some of the resources that have been developed already, and the passion of individuals who really are incredibly passionate about drowning prevention, how we can strengthen those relationships with government to capacitate, whatever policy implementation, but really around trying to capacitate the government strategy. I think we have several policy gaps in South Africa, so specifically around disaster risk reduction, specifically around pool safety and fencing, and specifically around incorporating water safety education and swimming skills more broadly in the school curriculum. And lastly, I think the disaster management community, I think, is probably one of those sectors that really recognizes the issue of drowning, and yet drowning prevention is not actively incorporated in a lot of the disaster risk reduction programs. And so I think we need to incorporate that more deeply into policies and actions and resilience programs for disaster risk reduction, because I suspect that we are going to see more floods, we're going to see more hydrometeorological disasters, and we know that about 75% of the fatalities that come from floods are actually drowning, and so we will see a bigger burden of this going forward, and we need to make sure that we are ready for it. Thank you for your time. I think I'm under my allotted. I just made it, but I appreciate that this is kind of a wide and very gentle touch on a number of issues that affect drowning and risk and drowning prevention in South Africa. but I hope it's perhaps opened up a field or a space that people have not thought about before, and maybe get some people thinking about drowning where they haven't necessarily before, haven't realized that it is an issue. Jeroen, I'm happy to, I can't see if there are any, but I'm happy to take questions and comments.
I'm also happy to field them for you. Colleen, I just want to say thank you very much for that extremely comprehensive talk on drowning, both internationally and locally. Yeah, during your talk, I had questions lined up, and then as the talk carried on, you answered all my questions. So I'm absolutely stumped as to what to ask you. So I'm going to open the floor to the very well-attended talk. We've got more attendees than we have in most of our talks, so that's also a sign of clearly how important this topic is and the respect you have in the field. So does anybody have any questions for Colleen? Heike, go ahead.
Thanks, Jeroen, and thanks, Colleen. That was a really great, very enlightening talk. I was just wondering, you mentioned that bodies of water on construction sites are also a risk. Is there a potential to include or expand local regulation on the management of kind of bodies of water or potential bodies of water, like you said, pits, either through local city regulation or provincial regulation?
I think so, and it was something I had never actually thought about until it kind of emerged from this media report data. And I think there's so I'm not directly answering your question, but I will. I think it speaks to how really important data is and understanding so descriptive data that's bigger than just age and sex. So age and sex is important, but I think we have a really good understanding now of who is suffering drowning in South Africa. But there's a lot of depth and nuance in understanding what it is that people were doing at the time that incident. So it's not just around, it happened in the ocean. It's what were they actually doing? Were they fishing? Were they on a boat? In some cases, they're walking down the beach and they get, knocked over by a wave or something. From that data, we were able to see that about 25%, I think, of ocean incidents involve rip currents. So there was some description of being pulled by a rip current. And so there's, we have quite a big body of work going in now with collaborators from the UK and weather services and NSRI and lifesaving around rip current forecasts. And so I think emerging from the descriptive data, these things that we are seeing around construction sites, around baptisms and religious ceremonies, around crossing rivers, I think those are really important opportunities to look at how we can address that. I very much agree with you that I think there's space to put that into building regulations. That sites need to be protected in some way. If you dig a pit, you need to make sure it is protected when there's no one on site. Maybe those are there already, but we're not enforcing them. I don't know. But the challenge is if we don't have really strong data, it's difficult to go to people and say, this is a problem. And people tend to want you to show them that they want you some empirical evidence to say this is a problem before believing you that it's a problem. So maybe the bigger answer is actually that I think what we need is a kind of in-depth surveillance system, not only for drowning, but for other injuries as well.
Thanks, Colleen. Wayne has a question for you.
Yeah, thanks, Colleen. Thoroughly enjoyed the topic and always well presented. Just in the event space, we are forcing event organizers when they hold these raves, etc. Not that I've ever attended one, but I believe a lot of them are pretty high risk because of the behavior that happens and the abuse of substances. And there has been incidents in and around rivers, in and around bodies of water. Is there anything in the pipeline regarding regulations or bylaws in that space? And then the other one is in triathlons. There was a period of time that we were losing, and Jeroen could talk to that as well. We're losing competitors, not in the training, but in the event itself. And so I'm not sure, again, this is hearsay, but some of the comments made by people who partake in those events is that the backup rescue services are not often what it's meant to be. So just both those type of questions for board. The second one for Jeroen and yourself.
Sure. Yeah. So I'll have a go at the first one and the second one, and then I'll hand over to Jeroen. But yeah, I mean, I spent some time managing lifeguard services within the Western Cape as well, and I had a number of requests for, you know, people wanting, they would have the big, I don't want to mention names, but a big festival on the river that's involves people floating around on buoys and drinking a lot, and they would want, you know, one lifeguard for the weekend. And I think those events. So to answer your question, no, I'm not aware of any regulations or bylaws or anything that are in the pipeline, but that doesn't mean that they aren't. I think that it's really important we have a culture that's very reliant on alcohol and substance use, I guess, to have fun around water. And we don't need that. And we know that alcohol increases risk because it increases riskier behavior, but it also, there's physiological issues around how you respond to cold water or submersion, etc. I think that we do need to spend, I think it's one of the policy gaps that we really need to address around the issue of alcohol and I guess events, and often they go hand in hand. I think the other events related issue is school outings and developing some kind of policies around what is required when you are taking a group of school learners to a water-based event, and what are our expectations around safety and the provisions that you make. Not cancelling those, because I think they're important, but actually how do we make sure that those are safe? And it applies just as much to these other events. Your question about triathlons is actually really interesting, and I think I could be wrong, but I think the swim leg in triathlons is often the one that has the highest rate of issues of the three legs. I think there are some physiological risks or factors really that play into that. I think often people that do triathlons are perhaps the swim is sometimes the weakest leg, and often the thing that they've had to train the most for. They often train in swimming pools and are not used to that kind of crowd at the beginning where you actually are getting pushed under. They're not used to the cold water, the quick submersion. And I think it's the leg where if you have some sort of underlying cardiovascular issue, it often comes to play when you hit cold water and you're in that race environment. But Jeroen can probably speak a bit more intelligently to that than I can. But I think one of the challenges with providing rescue backup in those instances is that, these mass starts, I've done a few of these, and it's really difficult to spot someone. You're not watching individual swimmers in those mass starts where everybody's heading for the buoy together. And I think that looking at ways in which we can stage starts, for example, in the swim legs, so that people are a little bit more dispersed. If they're not used to being swum over, if you're not a water polo player, you're not used to people pulling you under and swimming over you to get to the buoy. It is a really tricky sort of situation to try and manage as a rescue personnel. Jeroen, I don't know if you have, maybe I'm putting you on the spot, but anything around the swim legs?
Yeah, I mean, triathlons are a particularly risky event or sport, and you touched on it a bit. The one is that although it's a relatively low incidence, there is the additional risk of SIPE, so swimming-induced pulmonary edema, and that seems to be in predisposed individuals when they stand around on the beach or pre-swim and then suddenly enter the cold water and into a horizontal position and start exercising. For the physiology geeks out there, basically going from vertical to a horizontal position means venous return increases. Suddenly moving your legs activates the muscle pump mechanism against deep veins and also returns blood to the right side of the heart. And then the vasoconstriction in the skin by entering into cold water also redistributes the venous blood, which, 70% of your blood volume is in the venous circulation. And so that overloads the heart and results in pulmonary edema, and in certain individuals that has been fatal. And for the same mechanisms, the cardiovascular stress and the sudden change and the high sympathetic drive that happens suddenly at the start of a triathlon puts people at risk for cardiovascular events, so arrhythmias and plaque rupture and therefore infarct. And then there's the environmental conditions. So there's pressure on the triathlon organizers to make sure that all three legs take place. Sometimes the conditions in water, and particularly in ocean swims, are not conducive or safe for participants, and they're always having to try and skirt close to the limits, or sometimes exceed the limits. And so I think there's a need for very specific and objective criteria to decide whether triathlons can take place, and then enforcing those criteria. And then there's also the medical cover, which in smaller event organizers, there's obviously a fiscal issue there in terms of trying to keep costs down, and suboptimal medical cover is an issue. And once again, that comes down to potentially legislating that the appropriate cover and experience and credentials are there for these mass events. So it's a multifactorial issue, but certainly a risky area where these kinds of issues, and that doesn't even touch on the drowning risk as well. So that the risk is quite high, and for those multiple different reasons. Right. Does anybody else have any questions for Colleen? If not, that brings us right up to the end of the hour. So I want to say thank you very much, Colleen. That was a super informative talk, and I see very well received by everybody. And so thank you very much for sharing both your time and expertise with us. And thank you everyone for attending.
Thanks, Darren. Thank you, everyone.
Bye-bye, everybody.
Thank you, Colleen.
Thank you so
Bye,
much.
everyone.